These shots are very, very good. Nothing is 100% perfect. There are people who get breakthrough infections. There are people who get side effects, but we take risks like this every single day. The This is an unusual clotting disorder that's been associated with the Johnson and Johnson vaccine. There's a clot that takes place in a vein in the brain. This cerebral sinus venous thrombosis occurs very, very rarely. You mentioned 15 cases. The greatest rate is in young women, and the highest risk in women between the ages of 30 and 39 is 1.2 per 100,000. One out of 100,000 are vulnerable to this potential adverse effect. And that compares with a greater frequency of clots from other things that we do on a regular basis. So, for example, having a baby and delivering a baby is associated with clotting in about 10 to 12 out of 100,000. Taking oral contraceptives, the rate of this particular clot, cerebral venous sinus thrombosis, is 2.7 to 40 out of 100,000. The rate of protection of this vaccine is extremely important. The risk is there, but the risk has to be in perspective.
So let me ask you this then. Female patients in that age group you just mentioned, 30 to 39, should they consider, even though the numbers are low, opting for the Pfizer or Moderna vaccine instead of the Johnson & Johnson shot?
There might be some additional peace of mind from the other vaccines, but the Johnson and Johnson vaccine has definite advantages. It's one and done. It's more readily available in certain locales, and the risk of this side effect is very, very low. And now we know about this side effect, and we know that the treatment to this kind of clot is different. And so we'll be able to treat and protect people who develop this rare complication much better than we did just a few weeks ago. And the reason that we're able to do that is that we're sensitive to adverse effects. We're monitoring people, we're monitoring the vaccine, we're learning more and more every single day how to keep ourselves healthy and safe.